Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, compliance in what is the effect of compliance in obstructive lung diseases and restrictive lung diseases. So, if you see the compliance in obstructive lung diseases and restrictive lung diseases, intrinsic. Okay, first we will see obstructive lung diseases. In obstructive lung diseases, there is um, actually, in obstructive lung diseases, compliance is unaffected in obstructive lung diseases, except in emphysema, where the compliance is increased. So, compliance is unaffected in obstructive lung diseases, whereas compliance is increased in emphysema. Except in emphysema, in all the conditions, compliance is unaffected in obstructive lung diseases. If you see in the restrictive lung diseases, the compliance is decreased mainly, and there is also normal or increased forced expiratory volume in 1 second by forced vital capacity is seen.
thank you and thank you for watching.